This is Dr. Evan Osar with Fitness Education Seminars and Fitness Insider. We had a lot of questions regarding our last newsletter about scapular stabilization and precisely about Y's, T's, and W's and why they're not effective for improving scapular function. So I just want to demonstrate and more clearly explain why they're not so effective or not as effective for improving scapular stabilization. One of the key concepts I want you to get from this video and from the newsletter is the biggest dysfunction with scapular stabilization is the inability for the client to posterior tilt and upwardly rotate the scapula. Y's, T's, and W's teach scapular retraction, the exact opposite action that we need to have happen when our arm goes up overhead. That's why I don't use those to improve scapular stabilization. So I'm going to demonstrate with Marta exactly what I'm looking for with this scapular stabilization exercise and show you exactly what I'm cueing, looking for, and how this will improve her upward motion. Okay? So I place Marta against the wall here, and her arm will be at 90 degrees to her body, parallel to the floor. I want her to lean slightly into the wall so I have her feet a little bit further back than her body. She will stay tall through her spine through the entire motion because I'm teaching spinal neutral, spinal posture as well. She'll have a slight chin tuck to activate the deep neck flexors. She'll activate through her core to stabilize her trunk and spine. And then she's going to push away so her scapula are flat and controlled against the thoracic wall. I'll cue Marta now to lift one arm off the wall without changing position. Perfect, and back down. Remember, I'm not training the arm that's moving. I'm training the arm that's stabilized against the wall. Because remember, scapular stabilization has to precede mobility. This is mobility. The side that's moving is the mobility side. This is the stability side. This is what we need to improve in our clients. So then I'll have her switch. I'm going to constantly monitor how well she monitors and stabilizes. Go ahead, back down. Again, she controls the scapula. Lift this left side again. I'm looking for it is precisely how well she stabilizes this side, and she does. She does not get into her levator scapula and her neck. She keeps her core nice and controlled back against the wall. Switch sides. Perfect. And relax. Once she progresses from this and she does a nice job of doing about 10 to 20 repetitions, I'll progress her down to the quadruped position that you saw in the last video. That is a much higher level exercise than this is, but this is a great way to start to teach scapular stability, especially in those clients that are very kyphotic or those clients that are too extended through the thoracic spine. This is Dr. Evan Osar with Fitness Education Seminars. I hope this helped you understand some of the scapular mechanics that we're looking for and improve your clients that have shoulder problems.